We all know that accidents can happen at any time, so it should be a must and necessary to prepare ourselves by knowing the basic first aid to be able to correspond and be ready in emergency situations.
Cardiopulmonary resuscitation, also known as CPR, a life-saving technique useful in many emergencies, including heart attack or even drowning. Before you begin, look around carefully to make sure the area is safe for yourself and others before approaching. Shake them gently by the shoulder and ask them loudly, "Are you alright?" If there is no response, you need to shout for help, as any assistant will be helpful. The first thing you're going to do is to assist the unconscious person simply by remembering these letters: A, B, C. A is for airway. Gently tilt the head back, like this, to open up the airway. B is for breathing. Look, listen, and feel for sign of normal breathing. Look for normal chest movement. Listen for normal breathing sounds and try to feel their breath against your face. First, make sure that an ambulance is on its way. If you have someone else with you, ask them to make the call. Putting the phone on speaker mode is as useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when a heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second, and hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you don't need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands only, continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person are definitely breathing normally.
There are some emergency circumstances that a person you are at with have serious injuries and severe bleeding. It is necessary to know the basic bandaging techniques to prolong that person's life instead of waiting for the paramedics to perform the bandaging processes.
But before that, it is important to know how to do a square knot in the bandaging process. Pass the end in the right hand over around the end and the left and tie a single knot. Then pass the end now in the left hand over and the end in the right hand and complete the knot. Each loose end after the second knot is tied will be doubled back and lying against itself with the other end wrapped around it. The rule to remember in tying a square knot is right over left, then left over right.
Here are some of the bandaging techniques. First, place a towel or gauze pad to compress the wound on the head to absorb the blood. Then, hold the triangular bandage as it is. Hold both tails and create about an inch folding on the base to create a hem. Next, place the middle of the base on the patient's forehead above the brows while the hem is on the outside. Next, let the apex fall on the back of the patient's head, then bring the 2 tails around the back of the patient's head. Cross them over the point and carry them around the forehead. Tie in a square knot. Hold the compress or the dressing firmly with one hand, while the other gently pulls down the apex to secure the compress. Lastly, tuck in the excess fabric on the hem of the bandage. That's it for the cravat of the head.
Hi guys, this is to how to create of a job. Make an arrow, fold of the cravat, and place it under the chain of patient. Carry ends upward when one end longer than the other. Bring longer end over the top of the head. Cross both ends on side of the head. Pass the ends around the head in opposite directions. Untie with square knot on the other side of the head of the primary turn of cravat. Lastly, tuck in excess fabric. That's all.
I'm going to introduce the cravat of the hand. First, place the middle base of the cravat well up on the palmar surface of the wrist. Second is carry the apex around the ends of the finger and cover the back of the hand to the wrist. And then tuck in the excess fullness of the cravat into the small pleats on each side of the hand. Then cross each half of the cravat towards the opposite side of the wrist. And bring ends of the cravat around the wrist and tie the ends in square knot. And tie into square knot. And that's all.
First, straighten the arm at the elbow and place the middle of the cravat at the point of the elbow, bringing the ends upward. Then bring the end across where both extending downward. Lastly, take both ends around the arm and with a square knot at the front of the elbow. Tuck in the excess fabric in the hem of your cravat fold.
So this is how you do the cravat of the knee. First, you need the cravat fold. So you put the cravat fold over the knee and then pull the ends together. Make sure the wound or injury is protected and secure it with the square knot. Just like that.
Good day everyone, I am Johanny Claire and I am going to perform the 3 phases of a cravat. So the first phase that I am going to show you is a broad cravat. So in broad cravat, the first thing that we're going to do is to hold the base of the bandage with our left hand and the apex with our right hand. And we're going to fold the bandage into 2, making it look like a smaller triangular bandage. And after this is we're going to fold the apex and the base together. And this is what it looks like. And we're going to insert our hand here and straighten the bandage. So this
will be the final result. So this is the broad cravat. And for the semi-broad cravat, we will just simply use the broad cravat and fold it. So we're going to hold the apex here and the base here, and we're going to fold it together and insert our hand in here and straighten the bandage. So this is what semi-broad cravat will look like. And as you can see, the apex should stick out since this will be the indicator into where the injury is located. And for the final phase is the narrow cravat. So in narrow cravat, we will just simply fold the semi-broad cravat into two and straighten it. And this is the narrow cravat. That would be all. Thank you.
It is better to do something with little knowledge than doing nothing at all. Remember, the difference of doing something and doing nothing could be someone's life because it could mean the life and death of a person.